Okay. Well, we'll go ahead and get started. Again, I want to welcome everybody. This is Josh Hamann. I'm an orthopedic surgeon at Columbia Orthopaedic Group. Tonight's seminar is on needle arthroscopy, entitled, "Are You a Candidate for Needle Arthroscopy?" So hopefully you are here because you are interested in what the heck is needle arthroscopy and maybe something for you and something that we can help you with. I see there's a few people still coming into the waiting room, so I'm going to give it just another minute. Okay. So everybody can see the screen okay? All right. Well, we'll go ahead and get started. Today, again, we're talking about needle arthroscopy. And I wanted just to start by introducing myself. I am a sports medicine orthopedic surgeon here at Columbia Orthopaedic Group. This is a picture of my family, my wife and 3 kids. We live here in Columbia, Missouri. We've been here for over 5 years now and have really enjoyed being in Columbia. I'm originally from Iowa. We were in Iowa for a little while after my training and now back in Columbia. I trained at University of Iowa in my undergrad. Came to Columbia for medical school and stayed for residency. And then I went and did a fellowship at University of Virginia. And my practice is focused on sports medicine and arthroscopy, mainly in knee and shoulder arthroscopy. And this has kind of led me into this area of needle arthroscopy, and something I'm really excited about, something that I think can really help people. And really happy that you guys are here tonight to learn about it. Here in the office at Columbia Orthopaedic Group, I have a great team. Specifically Bill Bachhoven, who's my PA, Jamie, who's my secretary, and Natasha, who is my medical assistant, along with all the other great people here at Columbia Orthopaedic Group. But I certainly want to give a shout out to those folks for all their help they give me. So with that being said, let's talk about needle arthroscopy. And I want to begin with what is arthroscopy, and simply stated, it's a way to scope inside of a joint. And arthroscopy began around 1919, and this is a picture on the screen of an old arthroscopy. This was state of the art in the 1920s and 30s when these people would literally stick a camera or a little lens inside the knee joint. And why this was so revolutionary is because back before arthroscopy, the surgeon would have to make a big long incision across the front of the joint. Like this knee, he would have to make a really large incision and have to move the tissues and cut through the muscles and tendons to get into the areas they needed to get to. So in some ways, the surgery was actually worse than the problem. And so with development of the arthroscopy, we're able to look inside the joint with little tissue injury, and we're able to do much more surgery with less invasive techniques. And over time, we developed cameras with the ability to project onto a monitor, and then the cameras got better and better to where we're now seeing things inside the joint in 4K visualization. And so it really has evolved, and now the next great step in arthroscopy is the needle arthroscopy. And essentially this is smaller instrumentation that allows us to look inside the joint without even having to make a cut, without even having to use a scalpel or make an incision. We can look inside the joint with a needle or with a camera the size of a needle, and it really allows us to do some incredible things. Again, this is a needle-sized arthroscopy or needle-sized scope, and the patient that has the procedure is able to be awake if they wish. we can dynamically evaluate the joint, and it really can revolutionize how we are doing things. So next slide is just showing you a picture of a needle scope, a nanoscope, which is 1.9 millimeters in size. So if you compare that to a pencil, it's incredibly small. And therefore we can numb up the skin and use a needle to enter into the joint, and no incisions are needed. The benefits of a needle arthroscopy are, pretty numerous. I think the biggest thing is that we can diagnose problems in the knee joint at real time. We can go in there and dynamically look at the joint, meaning the patient is awake and able to move their knee on command, and so we can watch how the structures are moving while we're doing our needle arthroscopy. We're able to probe and feel the tissues, and can ask the patient while we're doing the surgery if that hurts. If we remove a piece of tissue, does that take away their pain? And so you can have pretty immediate pain relief during the surgery. It also allows us to do better diagnostics as like cartilage damage or other tissue problems in the joint at the time. And so rather than kind of guessing on an MRI or an X-ray, we can directly look at the tissues and make a diagnosis. And with that being said, this is a great option for people who can't have MRIs, someone who has a metal implant, or someone who's claustrophobic and just doesn't want to do an MRI. We can elect to forego an MRI and just go ahead and look inside the joint with our needle arthroscopy. And so again, the benefits here are multiple. What can we do other than just diagnosis with a needle arthroscopy? We can look and confirm meniscus tears and trim out or fix a meniscus tear, even do repairs. We can look for loose pieces, loose bone fragments within the joint, assess for torn cartilage and remove loose pieces of cartilage. We can remove inflammation or cysts. We can look at ligaments or take care of scar tissue within the knee joint. And again, tonight we're introducing the needle arthroscopy. So reasons why you would need a knee arthroscopy would be injuries or falls, other accidents that have caused damage into the joint, wear and tear or arthritis in the knee joint that may be a problem and causing mechanical symptoms. And so that would be something that we would fix with an needle arthroscopy. If you have popping, swelling, other issues, that would be somebody who we'd want to talk to about potentially a needle arthroscopy. And then, when is it time to think about a knee or a surgery like a nanoarthroscopy, a needle arthroscopy? If you've had knee pain for some time, it's not getting better, you've been dealing with it, and maybe you've had injections or taken medicines or done physical therapy, but we're still not able to get your knee better. Maybe this is affecting the way you live your life, and you just can't do the fun things that you normally would do with your knee. That would be time to think about surgery. And so again, I think that the needle arthroscopy is something for the person who's tried to get their knee better on their own, but yet just can't get there. And this really reduces the barriers to surgery because you can get your diagnosis, we can be treated very quickly and have a very fast recovery. And so again, something that we want to talk about knee arthroscopy for you. Obviously, this is a picture showing someone in the needle arthroscopy. We have our cameras, we have the screen showing the tissues, and so we can as we're doing the surgery, we're making our diagnosis, and the patient is able to see this right there. They don't have to be asleep. They don't have to wake up and be groggy, and then we tell them what's happened inside their knee joint during the surgery. They're awake and watching it. And I think that's very powerful. I think the education process for me as a physician to the patient during the surgery is really fascinating, because we can tell you at the time of the surgery what's going on and how we're going to fix it. we certainly are able to take pictures. We certainly are able to take videos of the arthroscopy so we can show them and review them later. But the real-time diagnosis is a really key thing for the needle arthroscopy. And then while we're doing your surgery, we can take care of things. We can talk about the plan on what we need to do to get you better, all during the procedure. And then it's very obviously looking at the tissue is the most diagnostic and accurate way to take a look at the knee. And so these needle arthroscopies are extremely effective and accurate. So as we've kind of introduced needle arthroscopy, I think what will likely tell the story the best is to show you what happens. And I've asked a patient of mine, Colder Evans, we've taken some videos of him and put this together to show what a needle arthroscopy would be like. This is a patient of mine who I'd treated for a while. He'd been having knee pain and swelling. He developed some scar tissue in his knee, and so we discussed doing a needle arthroscopy, and he elected to proceed. And so what I'm going to show next is a video of his surgery and how it went. And so I'm going to let the video play and kind of speak for itself for a while, and we'll talk about it in just a second.
You've been having knee pain, you've been talking about locking in your knee and swelling, right? And that's not really been getting any better. So today we're going to go in and take a look there and kind of get things cleaned up, right? Yeah. Okay. And you are an athlete. You're actually a track athlete, right? Yeah. You do discus. He's a state champion. So we're pretty proud of him. I'm proud of you. Very good. Okay, so we're going to go ahead and get you numbed up. All right.
Is it like straight right now?
Yeah, you're all the way straight.
I have not felt that in like over a year.
That's pretty cool.
Yeah.
Yeah, you can really tell that thing's all the way straight.
That feels, yeah.
Cool.
Wow.
Well, I think that's a big success right there.
Yeah.
You can already tell the difference with surgery. Yeah.
Yeah.
Feeling okay? You ready to stand up?
Oh, yeah.
Like right after surgery, you're gonna stand up?
I don't know how it's gonna feel in here.
Got it?
Yeah.
Look at you.
Yeah.
It's pretty good. You want to sit in the wheelchair? Or do you want to walk?
Oh, okay.
You.
Good job.
That's excellent.
So hopefully that video came through okay. I think it's a pretty incredible video because it's able to show how the needle arthroscopy can really acute or accurately diagnose and immediately treat and get the patient better. So this is a little breakdown of the timeline for a needle arthroscopy, just kind of here on the screen. What you saw in the videos before the surgery, I was able to talk with the patient. We discussed the plan. We discussed why we were doing it. We discussed, how things would go during the surgery. And then we injected some local anesthesia. We also used some oral medicines to help with inflammation and some pain right before surgery, but mostly it's the local anesthetic injection. And then we take the patient back to the procedure room where we do the surgery. We have the monitors on the wall to show both myself what's happening in the knee, but the patient is able to watch. And then I think one of the best things is, again, you're awake, you're able to talk with me about what's going on in the surgery. And right afterwards, as you saw, Colder was able to stand up. He was able to walk out of the operating room. He could already tell a difference in his knee joint. And I think that is, a really big benefit. With the local anesthesia, there's minimal pain after the surgery because things are numb. You don't have to have pain and as you're driving home. And so certainly a really incredible video, which I think tells the story of a needle arthroscopy. So the next step is, how do I know if I'm a candidate for needle arthroscopy? You know, obviously part of it is if you're here, you're wondering about needle arthroscopy. And I think if you're hearing these things that your knee's bothering you, you're having symptoms that haven't been any better, I think we typically talk in the clinic. We have you meet with me in the clinic for an appointment. We can review your previous studies like x-rays or MRIs or any therapy notes that you may have had in the past. And we're able to talk about, you know, whether or not this is a procedure for you. I wanted to go through a couple common questions about needle arthroscopy that I think you guys are already probably wondering about. And if you have more questions, feel free to use the question on the Zoom. But how long does this normally take? Typically, the procedure is about 20 minutes in length. It may be 30 to 40 minutes, depending on what we have to do and how long each procedure would take. But this is at the surgery center here at Columbia Orthopedic Group. This has been rated one of the best and the best surgery center in the state of Missouri a couple years running now. And we can really get you in for the surgery maybe about an hour or so before the surgical time. The surgery itself lasts, say, 30 minutes, and typically patients are out walking to their car about 20 to 30 minutes after the procedure. So it's certainly not an all-day thing. And I think that, you know, I think one of the barriers for people to sign up for surgery is I don't want to give up an entire day. And with a needle arthroscopy, you certainly wouldn't have to do that. I think this slide is the question that really has kind of got me into doing needle arthroscopy, and why I'm so excited about it is because it does not require a general anesthetic, and you can do a local anesthesia. Of course, we can do needle arthroscopy under a general anesthetic. We can do a standard arthroscopy with incisions and everything. But if you want to have the local anesthesia, the needle arthroscopy, you don't have to feel, you know, don't have to undergo the recovery of anesthesia. You're awake during the procedure, and you're able to watch the procedure if you wish. We can certainly talk about anything else during the surgery if you want. I've certainly heard plenty of stories while we've been doing needle arthroscopy. We've had patients talk about their vacations, talk about their activities like pickleball or anything they like to do. But again, you can be awake and we can discuss your knee while we're doing the surgery. And here, as you saw, our patient on the video, he was able to walk out of the operating room. We essentially just have to, after surgery, take a blood pressure, make sure you're doing okay. You change your clothes, you put your shoes on. We talk about some of the postoperative instructions, and you're really out the door. So it's a very quick recovery. After surgery, there is some soreness around the site, usually for the first couple of days. The next day, people have swelling and soreness as the numbing medicine wears off. There is a little bit of kind of a rebound type pain, but that usually doesn't last for very long. We have Band-Aids, there's no sutures, there's no incisions, and so very minimal bandages to worry about. We can have you walking and doing your activities very quickly. Patients come back and tell me they're doing some incredible things already after surgery, walking around the block. Some people are walking up to a mile or more, which is not always typical, but these people are really doing well, and it has been incredible to watch how people are recovering so fast. Typically after surgery, you're going to come back and see me in the clinic about 10 days after surgery. We can go over the procedure. We can talk about the next steps of recovery, whether that's therapy or exercises or how we need to get you back into your activities. Other common questions: can I drive after surgery? We typically would want you to have a driver to take you home after surgery, but people are able to drive, the next day, depending on exactly what they've had done. Some people, because of the local anesthetic, are able to return to work that day. Some people work from home, and so they go back home and try and get a few hours of work done after their procedure. Some people are back in the office the next day because their knee feels already so much better, and they're able to get back into their office and do a lot of work. Typically we're able to get you going a lot faster. Generally after surgery, you don't require pain medicines like narcotic pain medicines. Over-the-counter medicines like Tylenol and ibuprofen generally treat patients' pain. We can give you a prescription for some oral anti-inflammatories such as Celebrex after surgery. You may get a prescription for pain medicines just in case, but most people bring them back without having ever taken more than a couple pain medicines or pain pills. And so it's been really a very painless procedure. And of course, with the surgery, we can diagnose your problems, we can treat your problems, and generally people won't need any more surgeries. If it's an arthritic problem, we're there to clean it up. There may be continued problems with this arthritis, but generally people do very well not having to have another procedure after the needle arthroscopy. And then, of course, coverage by insurance. Needle arthroscopy is covered by insurance. We would have to go through a pre-certification, which our team takes care of that on our end. We work on that all for you. Medicare and private insurance pays for a needle arthroscopy in the surgery center. Some insurance companies do require you to undergo certain treatments prior to authorizing a surgery. And so they may require you to have an MRI. They may require you to do some physical therapy, but that would be insurance dependent. Certainly our team is very experienced at this, having done this surgery over 40 to almost 50 times now. We're very experienced at insurance coverage and getting the process going. If you have questions about this, I've listed a phone number here for those, and we'll have other numbers here as we go forward. So as we kind of start to wrap up on needle arthroscopy, the next step would be calling our office and requesting an appointment with me to talk about needle arthroscopy. Again, I'm very excited about this because I think this is the way arthroscopy is going. I think there will be, as this becomes more mainstream and people are ready to do arthroscopy awake, I think that this will become kind of the standard way we do arthroscopy. I think that having anesthesia and having the recovery from anesthesia is not as attractive for patients. And so in my mind, having the awake surgery, having immediate diagnosis, having treatments without incisions, Band-Aids for dressings, and being able to walk and move right away is really appealing. And so I think that this is kind of the wave of the future. I think that this is something that can really be a benefit to you as a patient. And I really hope that if this is interested to you, that you would take this number and give me a call. You can scan the QR code and hopefully we can talk and see about getting you feeling better with a needle arthroscopy. With that being said, we are ready for some Q&A. So I'm going to see. Let's see. So one of the questions was, what kind of physical restrictions are there after the procedure? And that would be really, we would really want you to take it easy for the first couple of days. There would be, just stick to walking. We wouldn't want you to be in the gym over the first couple of days. Usually the first 7 to 10 days, we want you just to kind of really be minimal activities like walking. Some people will do exercise bike to help with range of motion and swelling. But the restrictions may be limited, kind of dependent on what the surgery you have. It would be discussed at the time of surgery. While we're going over things, we would certainly have that discussion during the procedure on what we need to do. Let's see, it sounds like there's a few questions coming in. One question was, is this something that's only done in knees? The needle arthroscopy is certainly something that can be done in every joint. I primarily do knee and shoulders. Knees have been where we've started, and like I said, I've done over 40 knee needle arthroscopies. I do think there is a role for our needle arthroscopy in the shoulder. Certainly my partners here at Columbia Orthopaedic Group are doing it in the wrist. They're doing it in the ankle. And so there are all other joints can be assessed with this, but primarily right now we're just starting with knees. One question was, do you need to start with your another doctor before you come to see me? And I think no, I would certainly welcome you to make a phone call and make an appointment with me to start talking about your knee pain, so we can start treating you, whether that's with a needle arthroscopy or with therapies or other treatments. But no, you do not have to be referred in to see me. Some of the questions are, regarding arthritis and bone on bone, and certainly needle arthroscopy may be something for people with bone on bone arthritis, but it certainly would not be a cure. If you have, completely worn away your cartilage, a needle arthroscopy would be a cleanup type surgery, but it certainly would not, I would not be telling you that I can resolve the bone on bone arthritis. And so sometimes that may be too far gone for a needle arthroscopy. But if you're having locking and catching in your knee and there's loose pieces that are associated with arthritis, we can be treating that with a needle arthroscopy. In some ways, though, a needle arthroscopy may not be for someone who is completely bone on bone. Good. It looks like the questions are starting to slow down, so we'll go ahead and wrap up. I appreciate you guys' time. I hope you enjoyed learning about needle arthroscopy. Again, this is something that I'm passionate about because I think this could help a lot of people. And I think that if you're one of those, I encourage you to give me a call. So with that, we'll go ahead and end. And I thank you for your time.